Welcome back to another episode of Esports Metaverse
And
Beyond.
beyond.
And today I'm honored to be interviewing a trailblazer in the world of innovation, Dr. Kenneth Washington, Vice President of Medtronic and Chief Technology and Innovation Officer. Welcome to the show.
Thank you for having me.
Thank you. It's really an honor interviewing you. After doing our research, we found so many interesting things that you've created and helped work on.
Before we dive in, we like to ask our guests trivia questions to know them a bit better. Are you up for a bit of fun?
I'm ready. Let's have some
All
fun.
right.
It's game time. What's your favorite movie about robots and why?
Oh, wow. Probably The Terminator.
Hmm.
And I love that movie because it just tells us that we have to be very careful about robotics and artificial intelligence, but at the same time, it opened my pores of imagination about what could be possible one day.
That's a great choice. Personally, if I had to answer, I'd say Terminator 2. I don't think I've seen the original.
Really good. All of them are good.
We heard that when you were a kid, you were quite fond of Erector sets. Which Erector set was your favorite and why?
Wow, that was so long ago. I don't know what it was called, but I remember what I used to build with it. But my brother and I loved to build. We would take turns and have a little competition on who could build the tallest structure, who could make the tallest thing without it falling over. And so that was a lot of fun to figure out how tall could we actually build it. I think I got one as tall as me once.
That
Yeah, I
sounds
wasn't
fun.
very tall at the time, but it felt big to me at the time.
If you could have dinner with one historic figure known for their innovative thinking, who would it be and why?
Oh, that's an easy one. It would be Albert Einstein. He was an amazing individual who just did so many important things for science. And I'd love to ask him about, all kinds of things about his discoveries and his innovations. So, yeah.
That'd be awesome. Thanks for playing game time with us. Dr. Washington, I heard you put the tech into medtech. Could you summarize Medtronic's goals, what they do, and why it's important?
Well, I love working for this company because we have a mission that's so important for the world. Our mission is to develop and deliver medical technology that alleviates pain, restores health, and extends life. We develop products and technologies and therapies and diagnostic devices for your heart, the cardiovascular system, for your brain and what we call the neurovascular system. We also build diabetes products for people with type 1 and type 2 diabetes. And then we build devices and services for surgical procedures.
All great stuff. Hopefully, within the next few years, people with all those different medical problems could get the help of AI.
We're certainly hoping so. It's a big technology on the horizon.
Dr. Washington, during our research, we found that you've gotten 3 different nuclear engineer degrees at Texas A&M University, making you the first African American to do so.
Recently, you also received the 38th Black Engineer of the Year award from Bayer.
You're a history maker. Congratulations.
Thank you so much. I'm very humbled to have received that recognition and grateful for the education that I got at Texas A&M.
When you were young, did you ever imagine you'd be making history like you do today?
That's a great question. When I was young, I was very focused on making a difference and doing my best. My dad and my mom instilled in me the culture of not worrying about grades or anything like that, but just always doing my best. Every job that I took on, I just tried to do my best. And what happened is when you do your best, good things happen, and you end up getting into positions where you can make a difference and then be recognized. So
we hear more about your background and the influence your parents had on your education and also your engineering journey.
Sure, I'd love to talk about that. So my background was strongly influenced by my parents' expectations that, like I said earlier, to do my best, but more importantly, they really cared a lot about education. And they prioritized education above, anything else. And so it was very important to my parents that I stayed in school and I went to college, and because they saw in me a lot of potential. And so that was the key influence. When my dad got his PhD, that motivated me to get mine. And so the signal was clear. Education could lead to a great life.
It sounds like you came from an amazing family, Mr. Washington.
Yes, your parents
Well,
gave great advice.
thank you. Well, like most families, we had our ups and downs, but the ups and the positives definitely left a mark on me that really made it.
Well, that's great, Dr. Washington. So during your career, you worked on mainframes, electric cars, home smart devices, surgical electric robots, and more. What was the most challenging of these to create?
Well, every job I've had has had come with a number of really big challenges. As I reflect on the work I did at Sandia National Laboratories more than 20 years ago, we were trying to support the nation's activities in national security and also support nuclear power plant safety. So those are big, difficult, challenging problems that I feel very honored to have had a role in helping to solve some of those challenges. And then I went to Lockheed Martin. Some of my biggest challenges were building satellites and payloads that go onto satellites that had never been built before. One of my most proud moments was working with the team that built an instrument that is now flying on the James Webb Space Telescope. So it's a real honor to have said that I worked with that team. And then at Ford Motor Company, one of my big challenges and opportunities was to help steer the company to be more digital and to create the electrical systems in the vehicles that allow these vehicles to not just be great driving experiences, but to be great digital experiences. So those are some of the highlights for me.
Congratulations. Both of those sound wonderful. You've really made a difference in the engineering field, really.
Thank you.
What guiding principles have shaped the leadership approach throughout your career that have made you so successful?
Well, it's been a journey that's really been shaped by a small number of principles. Every job that I had the opportunity to do, I asked myself 2 or 3 key questions. The first question is this a job that would give me an opportunity to learn something new? Is it challenging me? Will it require me to learn? Secondly, I asked myself, is it an important job? Will it matter if we do it well? Will it change the world? Will it have an impact on society? And if the answer is yes, then it's the kind of job I wanted to go into and do well. And then last, is it the kind of job that is hard? Is it difficult? Is it challenging? Could anybody do it? So I gravitated toward jobs that were challenging and difficult because I knew that God had equipped me with a talent that I wanted to apply on jobs that needed to be solved, that required the kind of background and experiences and talent that I had, along with partners that I would work with. So those are the 3 things that I always ask myself before I take on any job. And if I can check those boxes, I feel good about digging in and trying my hardest to get it done well.
We read that Medtronic is working on robotic sensors using synthetic AI. Can you tell us more about that?
Sure. So the future of surgery is going to be robotic. Robotic assisted surgery leads to better outcomes because it can be more comfortable for the surgeon, but also be more comfortable for the patient by being less invasive. And so we have a robot already that's being used in multiple countries called Hugo. It's a fantastic product. But we know Hugo will get even better as we bring artificial intelligence and digital technologies to it. So we're hard at work working on some new artificial intelligence capabilities that will make Hugo not only better, but smarter. And I could talk for a long time about lots of different options, but the main point is that the world of artificial intelligence is bursting onto the scene at light speed. And we're doing our best to surf that wave of innovation, to bring those capabilities to not just our robot work, but to many of our therapies and solutions that we work on.
Yeah, I'm interested to see where AI goes too. Over the past few years, technology, especially with AI, has been booming. Do you think you could explain why that is?
There are a couple of things that have happened kind of in parallel that have come together at one point in time to make AI today the AI moment. The first is massive amounts of data that's available to train these new models. So AI has been around for over 50 years. So it's not new. But what's new is the way artificial intelligence algorithms are now put together in a way that allows big data sets to be trained on bigger computers and faster computers in a way that not only mimics human decision making, but can be as good or better than human decision making. A couple of big developments happened over the last several years that's making that now possible. One of those developments was the development of credible deep learning algorithms that was advanced by companies like Google and Microsoft. Secondly, computers have gotten so fast that they're able to process these big deep learning networks in a reasonable amount of time. 15 years, 20 years ago, if you tried to run these big deep learning models on a computer, it would take too long, so it wasn't feasible. Today, it's very feasible and it's actually affordable. And so all of this is coming together to make today the AI moment. So we can bring artificial intelligence to products like robots, like our GI Genius product that allows people to detect cancers in a more effective way. So there's all kinds of great things happening because of artificial intelligence.
Yeah, AI brings a lot of great things to the table, but they also have their downsides. What do you believe are the biggest challenges and risks associated with integrating AI into healthcare?
There are plenty of challenges. So it's very important that artificial intelligence is developed and deployed in a responsible way. Responsible AI is easy to say, but it's actually hard to do. And that's one of the reasons why very early on, Medtronic went about developing some guardrails, some principles that we would use to guide our AI development. We called it our AI compass. And it represented a couple of key guardrails or guidelines for our employees to always keep in mind when we're thinking about building a product or even using AI internally in the company. Starting with AI should always be only thought about if there's a beneficial use. Secondly, it always has to have safety and the effectiveness of the product you're building in mind. All AI has to be done through the lens of fairness and non-discrimination, high quality, human oversight. So we think of AI as a helper to humans, not as a replacement to humans. And then lastly, everything we do with AI has to be in service of the security and privacy rights of the people that the AI and the product would serve. And we do everything in a transparent way. So these are the principles we laid out, and we follow these principles in all of our AI activity. That helps mitigate the risks of AI.
What are some ethical concerns that should be considered when implementing AI into healthcare solutions?
Well, it's a fairly new and growing field of using AI in health tech. But the good news is healthcare is recognized as one of the fields where AI has the opportunity to do the most good. And so as we lean into that opportunity to do the most good, we have to take care to address some of the ethical questions, like, is the AI introducing bias into the product? And have you asked for permission and beneficial use to ensure that the data that you're training these AI models is you have the authority and the right and the approval from the people who own the data to use it in that way. So these are just a few examples, but it's a very complicated topic, but it starts with those principles that I already spoke about. If you start with those principles, then some of the ethical dilemmas that people wrestle with will get easier to deal with.
From Medtronic's perspective, how do you see AI impacting healthcare within the next 3 to 5 years?
Well, the good news is we're just starting. And so in the next 3 to 5 years, we're going to see artificial intelligence be introduced in many products. It's difficult to predict how exactly it will show up, I mean, if you just think about your life, 3 or 5 years ago, and my life 3 or 5 years ago, it was totally different. So it's so difficult to predict what technology how it will evolve on a timeline that's far away, that is that far away. But a couple of things that are pretty good bets. One is the experience that patients have when they interact with their healthcare provider, I believe is going to get much improved because of AI. Because clinicians and doctors will use AI to take on some of the tasks that today they find distracting. So it's taking time away from their interaction with the patient. So they're filling out forms and doing data capture. These are things that AI could help them do. So the actual experience of visiting the doctor will get better. I believe outcomes will improve as AI is used as an assistant to the doctor to be an extra pair of eyes or a guiding pair of hands as they use a robot to do surgeries. And then last but not least, I believe AI will be used inside of companies who are building healthcare products like Medtronic to be more efficient and effective. So it's a fantastic productivity tool to help us do more good for society by being more efficient at what we do.
Earlier on in our interview, you mentioned that AI can be used to help patients and individuals with diabetic issues or heart problems. But how do you feel that AI will continue to help people with these issues in the future?
Let me give you a couple examples. Today, the products we build in our diabetes business are already powered by algorithms that you could consider to be AI-based algorithms. It allows for people with type 1 diabetes to use our continuous glucose monitoring products to monitor their glucose levels that then is sent digitally to our durable pump called the MiniMed 780G. It's one of the newer products that we have FDA approval for to operate in the United States. This provides for automatic insulin delivery, smart dosing as we call it, using algorithms that we consider to be best in class. With artificial intelligence growing in capability, those algorithms will only get better. And that's going to make for even better lifestyles for people with type 1 diabetes. I'm really excited about the potential of having those algorithms become so good that people with type 1 diabetes will have better lives, and they'll need to think about their diabetes less often because the AI working with the technology we build will be doing that thinking for them. And again, this is an algorithm that works with people, not replacing people, but it works with people in a way that makes for a better life for them. So I'm really excited about that. When it comes to our cardiac business, since you asked about that, our cardiac business includes diagnostics for measuring how well your heart is behaving. We already have a product that measures your heartbeat, and then it sends those measurements to an AI algorithm to then help the doctor determine with fewer false positives whether your heartbeat has irregularities. That's changing people's lives. Those algorithms are only going to get better with AI in the next, say, 2 to 5 years.
AI really is beneficial to humanity. And although this may be hard to predict, really far out into the future, do you think AI could help extend the average person's lifespan from, let's say, 80 to over 100 years old?
Well, humankind has a track record of being really bad at making future predictions. So I'm not going to make a prediction about the correlation between AI and lifespan, but I will say that I have high confidence that AI and other healthcare innovations and developments will make for better lifestyles and better life experiences, better healthcare delivery. This is not a field that Medtronic works in, but I see signals that are very clear that artificial intelligence and advanced computing is helping the pharmaceutical industry do drug discovery in a more profound and effective way. So I'm very optimistic that AI is going to help us discover and create new therapies and new drugs that are going to solve many of the healthcare problems of society in new ways. So hard to predict exactly where that will land, but I believe the trajectory is only going to be in the positive direction.
Well, only the future will tell. So let's see.
Dr. Washington, are there any AI projects underway at Medtronic that you're willing to share with the audience?
Well, our policies don't allow us to talk about things that are still under development. Other than I can just tell you that we are very serious about artificial intelligence and robotics. We're very transparent about the fact that those are my top two priorities. And because of that, we've created an artificial intelligence center of excellence, which will be focused on developing new artificial intelligence products and therapies and technologies. And so watch this space closely, and you will see that that focus and that commitment will translate into a series of new products that we'll be talking about in the market here in the coming months.
At the World Economic Forum not too long ago, we saw places such as the UAE implementing mandatory AI training for the government and citizens.
In your opinion, how can we democratize emerging technologies and start raising digital fluency in our children here in the United States of America? Should we use the UAE's format or create our own framework?
Well, every country has its own culture and its own political, framework. And I think the United States has a very different political system than the United Arab Emirates. And so we have to write our own playbook for how to raise the literacy of AI in K through 12 and also in our university system. The recently published presidential order on artificial intelligence is a fantastic start. This is it's a fairly, I think it's the longest presidential order in history. Our company, and just like every company that works in the AI space, is spending time trying to consume and make sense of it. It's a start. I think there will be a series of actions that will follow as a result of that presidential order, including some expectations and new policies and new guidelines, and it will evolve from there. I think personally, every individual in the country should be taking responsibility for their own literacy when it comes to artificial intelligence. I think of it kind of like any other advanced technology that has emerged in the last 20 years. In the last 20 years, we've seen a number of technical revolutions. Those revolutions came upon us pretty quickly. I mean, I'm old enough to remember when the internet was born, and you two were born while the internet was in full force. I was not. And so when the internet came, a lot of people didn't know what to do about it. They didn't know how to use browsers. They didn't know how to fold it into their workflow, didn't know how to use it in their personal life to their advantage in a responsible way. It took a long time for people to transition from writing documents with typewriters to writing documents with word processors that were connected over the internet with resources like, or even using Wikipedia instead of using encyclopedias. It's making me sound really old compared to you two, but I'm sharing that example because the literacy required to be effective as a human when that transition happened was on me and was on every individual in the country. And so I had to do a bunch of self-learning about, well, how am I going to change my model of how I'm doing work and how I do my studies? And AI, I think is going to be kind of the same way. How you educate yourself on using this new tool? How will you change your education flows? there, you could use ChatGPT responsibly, or you could use it irresponsibly. How do you learn the science and the skill of prompt engineering? These are things that literacy will just evolve because individuals will take it on. So government doesn't need to tell us to do this. We need to tell ourselves to do this. That's my encouragement to everyone who might listen to this story, to own your own literacy, because the government's not going to help you.
That's great advice. Everyone should keep up with the times and make sure they have an understanding of what the future might hold, with this case being AI now. So really good
That's right.
advice.
Yeah, I mean, there's so many really cool examples in history that we can learn from. I mean, I talked about the internet, but the same story could be told about mobile phones when they became commonplace. And now almost no one has a landline in their home. So you have to like teach yourself how to use these mobile phones in a way that advantaged you and like integrated you in with society. And same thing with color TVs. And I mean, I could go on and on. You get the point that we all own that responsibility.
Yes, and with technology always advancing, it's great advice just to make sure you have a good understanding of it.
What should kids who strive to be engineers do to prepare themselves for the future?
Well, I would encourage young people who want to, or who aspire to be engineers, to do a modern day version of what I did when I was a kid, which is tinker. Just play with tech. And that was like my hobby. Like I did the 1960s version of it. And so I would do the 2020s version of that. So in 1960s, my version of it was I took apart household appliances and I played with my Erector set, and I had a chemistry set, and I just tinkered and I built things and I played with things. I was curious about how things worked. And so the 2020s version of that is tinker with modern technologies. Get an Arduino, get a Raspberry Pi, or learn how to program in Python, and tinker with the online Python and AI library sets, and learn how to do prompt engineering with ChatGPT, and tinker with building digital physical products. And there are all kinds of robotic kits you can buy, and get your parents to buy you one for Christmas, and tinker with it. Learn how drones work, and play with technology. Just tinker and learn and stay curious, and that will prepare you well for. It will cause you to ask questions that are deeper as you get into your formal education, and it'll cause you to be prepared to take on the harder and more sophisticated aspects of the educational journey of learning and being trained as an engineer. That would be my advice. Just dive into experimenting and tinkering and staying curious in everything you do.
Phenomenal advice.
Yes, thank you. And before we finish, what final piece of advice would you give to people as we enter the age of artificial intelligence?
Spend a little time thinking about guardrails and educating yourself on what principles you should apply in your own use of AI. Use it responsibly and use it in a way that is respectful and transparent. And secondly, don't be a victim to it, be a master of it. So learn about it, tinker with it. And thirdly, if you're in the workforce, be an advocate for change and acceptance of AI, because every company, I believe, is going to be a company that will be advantaged. Companies that are not advantaged by artificial intelligence, both in how they support and advocate for their workforce, and how they develop and deliver products that serve their customers, I think if you're not doing that with the aid of modern technology, in this case AI technology, you will be at a distinct disadvantage. And so my advice would be a change agent, be an advocate for that change within your community and within your workforce and your personal life as well.
Well, thank you for all that advice. That was a great summary of everything that you've talked about. And we've learned a lot, and hopefully our audience learned a lot too. But before we go, how can people find out more about your future innovations at Medtronic?
Well, I post about things that we do at Medtronic on LinkedIn often. So look for me on LinkedIn and follow me, and you'll hear all about the things that are important to us as they become public. So just look for Ken Washington on LinkedIn, and you'll see the things that we do and things that I'm personally engaged in.
Well, thank you, Ken Washington, and the audience for joining us in today's episode of Esports Metaverse and Beyond.